filler for the smile lines. Now the lines have come back again. I did filler for the 2 smile lines 2 weeks ago. In the same time, the lines were gotten rid of, but now the lines have come back again. It looks like I didn't do any filler. And also, I did filler to my cheeks to make the lines more tight, but without any benefit. I just spent my money without results. What can I do to get rid of the smile lines?
Thank you for your question. You submitted your question and you describe a situation where you had fillers done for your smile lines 2 weeks prior. And you say that you had initial improvement and now the smile lines came back. In addition, you say that you had filler placed in your cheeks to add more tension to help improve the smile lines, and you are frustrated that you've spent money and these smile lines have come back. So you're trying to get some understanding of what is happening. Well, I can certainly share with you my approach to this area and the consultation process that I have with my patients who have similar concerns in my practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Injectable fillers is a very big part of my practice. This is for every area that you can think about in the facial volume, whether it's for cheek volume, whether it's for nasolabial folds, whether it's for chin, as well as for lips and the under eye area. This is something that we do a lot in our practice. And I think it's very important for you to actually have some guidance with your doctor as to what was the expectation as to the degree of improvement. And I think this is important. When I talk to patients about this particular area that is very commonly of high concern, people feel that that area makes them look much older. And I would say that it is something that I address particularly on people who have facial aging changes. And that's in contrast to people who are relatively young. The reason being is that when you think of this particular area, the anatomy of this area is actually something that is frequently discussed in our field. And the anatomy is such that represents that particular line, represents an area where several facial muscles actually are attached. Further, at the deeper levels, there are important connections and blood vessels. So it's an area that doesn't just pop away. And I would also ask you to also think about, what did you look like before the procedure? And I think it's important to review this with your doctor. I think that a lot of times people want to see something disappear completely, but when you review the photos, you might see that there was some improvement. Now, when it comes to this area, there are certainly a wide range of opinions about the best way to treat this area. A lot of my colleagues will even say they won't even bother treating this area because it's frustrating to manage this area. What I would say is, when I look at this from a facial aging perspective, I look at the global facial aging process. And you did address some of that with the cheek volume. And I think you're on the right track. When I look at someone who has a concern about this type of issue, I often employ a technique called structural volumizing, where I place volume at the bone level at the cheek area, and that actually, when it restores harmony, makes the nasolabial fold look better. Now, it is pretty common for me to combine the placement of filler on the cheek with some filler at the nasolabial fold level. And it depends on what I perceive as a relative hollow in bone volume. So without getting into the details of the particular anatomic structures, I would say as you go higher on the nasolabial fold, there is a potential space that is more amenable to volume correction. I think a lot of my colleagues get frustrated and their patients get frustrated because the filler is placed maybe just under the skin, which means with movement of those facial muscles which are attached, the material moves and shifts. And when it's placed at the skin level or intradermally, well, then it kind of looks like a narrow band. Now, that being said, I think that the best candidates for this type of filler are people with either a genetic volume deficit or a significant amount of age-related volume loss. So I think it's important that you review your photos with your doctor. Look at the big picture also. Look at your facial anatomy. I am confident that with the cheek volume improved, you may see that the contrast of the cheek to the nasolabial fold and the harmony of the facial balance has probably improved. I think it is less realistic to expect those lines to be completely gone. I think that yes, that initially you may have had a better correction because there was volume and there may have been an element of swelling. And it is something that I do in my practice routinely is to see my patients 2 weeks after an injectable filler to see how they look, to learn what is their particular response to that filler. And we get to review what they look like before and what they look like after to get a sense of how successful this result was. And I think it's important to have that kind of dialogue and relationship with the doctor you've chosen to do your fillers. I think it's important to really learn, for the doctor to learn what is right and optimal for you. If it turns out that this is not the best way to allocate resources, then it's maybe better to just look at the whole face and see what other things you can do to help you look your best. So I hope that was helpful. I wish you the best of luck. Thank you for your question.